Welcome to Villa of Hope Radio. Brought to you by Villa of Hope, partnering with individuals, families, and communities to rebuild relationships, recover potential, renew hope for the future. Villa of Hope is all about your personal journey because you matter. Now, with caring hope and respect, we're proud to bring you Villa of Hope Radio.
Well, hello again, everybody, and welcome to the Villa of Hope radio show. This is J.C. DeLass, and we're so glad to have you along to listen and learn more about Villa of Hope, Rebuild, Recover, and Renew. And joining us on the line, Christina Gullo, who's the president and CEO for the Villa of Hope, and also Megan O'Donnell, who is the director of community-based programming there. We're going to start with the big boss. Christina, great to have you back with us. And again, great opportunity, I think, for folks, especially, we're all kind of stuck at home or not really in our normal routine. This is a chance really for you to let those folks know Villa of Hope, still things going on there that people need to know about.
Yeah, very excited to be back and really excited about the lineup that we have. I think it's going to be really informative for people.
Great chance, again, to learn more about the programming that's happening, and we're going to get to Megan in a second. But, Christina, I want to talk to you, just kind of an overview. Remind folks, again, Villa of Hope, what's that all about? Just so they have, if they didn't catch the first show we did and they're not really sure what Villa of Hope is, kind of give us that thumbnail sketch for them.
Sure. So Villa of Hope, the history was really a residential provider for many years. And over the last 9 years, we have transformed that, and we have very limited specialized residential, and we have expanded and specialized in trauma-informed care work. So we're a certified sanctuary organization, the only one in Rochester. And we use that trauma work in our 4 core areas of education, care coordination, work-based learning, and behavioral health. And that's both mental health and substance use disorder. So those are pretty key areas for us. And the programming that we're going to talk about today specifically that Megan's really involved in is a lot of prevention work. And those pieces are really, really critically important so that the needs that families have do not become so acute that they need higher level services.
And Christina, Villa of Hope, you have, I guess, in essence, a campus or at least a facility. Where are you located in the Rochester area?
So our main campus is on 3300 Dewey Ave here in Greece, and that's where our school is. We have a day school here on our campus, so we serve students from all surrounding districts. We average we're probably about 70 students. And then our specialized residential is here. But then all of our other programs are either on our J Street location because they're very community-based and home-based, and our clinic is there also.
And before we get into the community-based programming, which really is a big chunk of this first segment that we want to talk about, I want to make sure we hit the website because I know, Christina, that's something you guys are really proud of because all of the information, really a great way to reach out to the community. It's right there on the website. Let's give people that information as well.
It is. So that's villaofhope.org. And what will come up first on that homepage is an opportunity if people are interested in terms of helping to support the COVID-19 emergency fund and some ways that their dollars could support us. But it also has critical information for those that might need assistance or those that just want to learn more.
Christina Gullo is the president and CEO of Villa of Hope. We're going to talk to her more a little bit later on, but let's jump in now with Megan O'Donnell, who's the director of the community-based programming for Villa of Hope. And Megan, let's really start right there. As the director, how many years have you been involved with Villa of Hope, and what's some of your day-to-day duties there?
Yeah, so I started with the Villa of Hope 7 years ago as an intern, actually, in our preventive program, and then kind of just stayed and worked my way up, and here I am as the director now. So my day-to-day is assisting the program managers of our various community programs and just helping them with their day-to-day programming and anything that they might need. And those programs are adult health homes, children's health homes, Hope Place, and our preventive programs.
Now, there's quite a few parts there. Let's take them one by one. Start with the first one again and what that is specifically.
Yeah, so our adult health homes program is a care management program for individuals who are 18 and older. Mm-hmm. They get connected with a care manager through the villa, and those care managers help them come up with a service plan of anything they might want to work on, getting connected to mental health services, substance abuse services, finding housing, and making any of those connections that they might need, while also working with other program providers that the families already have working with them, so that they can kind of just all be on the same page and have the same goal in mind to help the individuals. Children's health homes is similar to adult health homes, but they work with children that are ages 4 to 21. And those youth have to have a qualifying mental health diagnosis or other chronic condition that affects their daily functioning. And they also get connected with a care coordinator who helps work with the entire family, also connects them with any services they might need, but also helps develop healthy coping skills, positive family interactions, appropriate social skills and communications, academic success, and any other needs that the family identifies.
Very good. And I know there's still other parts as well to the community-based programming?
Yes. So then we have Hope Place, which is our newest program, and it's a drop-in center that is ran by peer support specialists. And this is for people who are experiencing any sort of substance abuse concern, mental health concern, or just feeling like they're not sure where to turn. They can come and meet with our peer specialists who can connect them, again, to any services in the community that they might need. We can refer them to any program within the villa and outside of the villa, so our health homes program, our mental health clinic, food pantries, anything that they might need assistance with. And it's also just a place for them to come and decompress, take a break, regroup. And the unique thing about Hope Place is that it is ran by our peer support specialists. So these are individuals who have been in their shoes before. They've been down that road, and they can really help by offering their own experiences.
Megan, it really sounds like these community-based services, you've got to get face-to-face, and many times, or at least that's what you've had to do in the past, getting into people's homes. You just can't do that right now. So how is this COVID isolation, how is that affecting how you guys do what you do? Yeah.
So our preventive programs, which are the last programs that I have in community, it's an umbrella. There's 4 underneath those, aftercare, general counseling, transitional, and JRC. And all of those programs are Monroe County contract programs, and they really focus on just keeping the youth in the home, keeping the families intact, and just also helping them with getting them connected with any services they might need, and also helping with parenting support, using evidence-based models, and things like that. So that program, all of those programs, our social workers are actually still doing their monthly home visits in the home with the families to assess for any needs that, the families might have in person, as well as, just assessing the safety and making sure everyone is, good to go. So they're practicing, using the PPE and making sure they have masks on and gloves and anything like that. So they're still going in-home face-to-face, but the other programs are connecting with all of the families via phone or Zoom. And they're trying to connect with each family probably weekly just to, make sure everything's okay, see if they need anything, see if we can help with anything from afar in that sense.
Megan O'Donnell, who's the Director of Community-Based Programming for Villa of Hope. I mean, it really sounds, obviously, safety is the first and foremost concern, and it sounds like you and your staff are really going above and beyond to make sure the clients are safe, because that's priority number one, isn't it?
Yeah, absolutely. Yeah, well, these are really hard times for everybody. Stress is high. The kiddos are home. People are trying to homeschool. It's just a lot for anybody to take. So we're just really trying to check in with these families, make sure they have the basic needs met, and see if we can help them in any other way that we can.
How about this pandemic and what you've seen in terms of how it's affected your staff? Because I know as we talk to others, this really is a time where we're seeing people kind of rising to the occasion, if you will. And I know your staff has done that for you as well.
Yeah, absolutely. I mean, the staff are still going above and beyond, even from home. They're helping each other out, offering support where they can. We're an agency of feelers, so we all really like to connect and see each other. So that's been a huge change. So I know a lot of the staff are trying to, connect via Zoom and have, positive parties and things like that. So they're still trying to keep the morale going and just offering each other support where they can and, still trying to stay connected.
How about in terms of the mental health and changes that you've seen now overall with your clients? Again, because these are difficult times, and we all know that, and we've all hearing that so much that sometimes I think we become numb to the fact that it really is difficult, especially for the kind of folks that you're dealing with.
Yeah, absolutely. I mean, I think just like everybody else, everyone's experiencing a higher level of anxiety and stress and just facing the unknown and trying to understand that, a lot of us just don't have the answers of when this will end or when things will go back to normal. So I know that that's really challenging for people. But a lot of families have been reaching out to their care managers and their social workers to kind of talk through those feelings and, just having somebody that they can call and talk to and have that conversation with, I think has been really helpful for our families.
Megan, how about listeners that are certainly struggling in these times with their own mental health situation? Is there a way for them to reach out for help? I mean, what are some of your suggestions or things that you've seen that you think could work for everybody right now?
Yeah, absolutely. So clearly the Villa is up and running, and we are ready to help anybody that needs it. So there's a couple of options. You can go on our website, which has all of the information you would need about the Villa, about individual programs. But we also have an intake hotline that people can call Monday through Friday, 9 to 5. That number is 1-833-933-HOPE. And someone will answer. You can talk through kind of what's going on, and they can get you connected to the program manager that best fits your needs. You can also call Hope Place, which is still up and running as a food pantry service. They'll deliver you groceries and things like that if you're in need. And that number is 1-877-584-HOPE. And then our main office is at 1099 J Street, and although we are not open for people to come visit us right now, we do still have our admin staff who's answering the phone. So you can call our community number, and they can get you connected to myself or any of the other program managers.
I would imagine, Megan, one of your challenges and your staff's challenges are getting past that stigma of mental health and needing help. It's difficult for people to reach out because there is that stigma, unfortunately.
Absolutely. Yeah, I mean, I think my hope is that eventually we'll break that barrier down and everybody will realize it's, the new normal to need help and to reach out and that it's okay. And we are absolutely here to help without judgment. And we hope that we can help you or your family or anybody who needs it. So I would just encourage anybody who even has an inkling that themselves or someone they know or a family member may benefit from our services to just give us a call and reach out and talk through it with us.
With plans already in place, I mean, we hope that all of this, the COVID isolation and the quarantines, everything, we hope that's all going to get behind us sooner rather than later. We don't know yet in terms of timing, but we're hoping it'll be very soon. When that happens, Megan, what are some of the things on your priority list? Obviously, planning continues and where you're going to go with your programming. Do you have kind of a priority list already drawn up? Is that something, a work in progress?
Yeah, I mean, we just want to continue to grow and be able to help as many families as possible. So currently for our preventive programs, there's some changes with the Families First Act, which is really focusing on prevention programs in the home to, prevent placement and just keep the kiddos at home with their parents. So really growing our preventive program and expanding the evidence-based models that we use and just helping as many families stay intact as we can. And then also hopefully push out into other local counties with our preventive services. Currently, right now, our Children's Health Home program serves a few of the surrounding counties, but we'd really like to see the Villa expand our community services to spread across Monroe and also the surrounding counties.
How about the new technologies now, Megan? How do you think that will help you moving forward once again, once we get past this isolation period?
Yeah. So I think this made us all realize how great technology can be. I think before, technology was kind of scary, and although I definitely love the face-to-face contact, I think that technology is our friend, and we should continue to utilize it. I think that some of our families have been more comfortable talking with their workers and their social workers around the issues that they might be having or their feelings with it being over the phone or over Zoom. They maybe don't feel as vulnerable being face-to-face with someone. So I think that's definitely a benefit of it. And so I just think that we need to keep an open mind about using all of this technology moving forward.
We talked about the website, villaofhope.org. And again, you gave out some very important phone numbers, Megan. Let's give the folks those numbers again.
Yeah, so the general intake line is 1-833-933-HOPE. And our Hope Place program is 1-877-584-HOPE. And all of these numbers and program information is listed on our Villa of Hope website.
And unfortunately, as you said, right now, people can't necessarily come visit to help you in person because of the current restrictions. But I know you're going to look forward to that day, hopefully very soon again, when people can help you on a one-on-one basis or at least do what they can to pitch in and help out.
Absolutely. We miss it. We miss seeing people and going into the families' homes and really just getting on their level and talking with them and, helping them with what they need. And technology is wonderful, and we will absolutely continue to utilize it, but there's something to be said about being able to go into a family's home and help them where they're at and really build that relationship with them.
Megan O'Donnell, who's the Director of Community-Based Programming for Villa of Hope, thanks so much for sharing your story. I know you're really looking forward to, there's no getting back to normal, right? I mean, we all hear the new normal and all that stuff, but yeah, I know for you, you're looking forward to getting back to maybe a little bit more normal, right?
Absolutely. I used to think maybe I'd like working from home, but I realized that I really enjoy my office and I miss it. So I'm looking forward to getting back there with everybody, and I know everyone else is too. I
don't blame you one bit. Well, thank you for being with us on our show this time. And again, we look forward to talking to you again in a future show as well.
Absolutely. Thank you.
We're going to come back, take a break, and bring Christina Gullo back in, the president and CEO of Villa of Hope. We're going to talk more about being a catalyst for community change. You are listening to the Villa of Hope radio show right here on the WYSL stations.